Welcome to Healthcare Ops Wave. It's not only an acronym for how, but also healthcare operations and waves are actually very similar. Both are steady, run in cycles, and have the odd storm in between. I'm Frederik Mueller. I'm the co-founder and CEO of Third Way Health, and we'll bring you the stories that shed an inside look on the humans behind healthcare operations. Welcome to another episode of the Healthcare Ops Wave. And I'm very excited to have Graciela Soto Perez here with me. She is the CEO of the Altura Centers for Health. Welcome, and thank you for taking the time.
Hi, Frederik, and thank you for having me.
Excellent. I was doing a bit of research, and this is certainly not your first rodeo, and so I'm very excited for this episode because I think there are a lot of really interesting things that that you all are doing at Altura Centers for Health. But also, you have seen the organization for a long time. How long have you been with the organization? And maybe just to start us off, can you tell us a little bit about Altura Centers for Health and also your journey, how you got to where you are today?
Yeah, so I will be with the organization 22 years in August. It's been a long time. So Altura Centers for Health is a federally qualified health center. It is an FQHC. We are a nonprofit. There are many types of FQHCs. Some are nonprofits, some may be other types of entity, but for the most part, most of them are nonprofits. FQHCs, as you know, they are located throughout the entire country. So we're not the only ones in California. California has the majority of FQHCs. So we are very fortunate. And so that's a little bit about what our structure is. We are deemed by HRSA, the Human Resource Service Administration, and under that is the Borough of Primary Healthcare. That's our governing body for these FQHCs. Now, Altura Centers for Health was founded by the hospital here, local hospital, back in 1995 as a rural health clinic. And then they sold it. They didn't want to be in the clinic business anymore. It's got its independence July 1st, 1998. It's been on its own. Became an FQHC lookalike in 1997, actually, under hospital ownership. And then in 2000 became an actual FQHC. So you may wonder, what are the differences between a lookalike and a actual FQHC? The requirements are much more demanding of an FQHC. Section 330 is what they also call it. FQHC, community health centers, Section 330, those terms are all synonymous. But that means we get the grant. But with that grant comes a lot of responsibilities, accountability, and obligations. We're very fortunate to be a grantee. In addition to that, we are also deemed a migrant health center, which is additional funding. There are special pockets of money under Section 330 that you can apply for, and that was one of them. And so we did that as well. And so that's it. We have 9 locations. We are located in Tulare. Tulare is located in Central California. I usually say, most people know where Fresno is. It's about 45 minutes south of Fresno. And if you don't know where Fresno is, it's by Sequoia National Park. So that's where we're located. It's very beautiful. We are known as the breadbasket of the world. Definitely, Tulare County was named one of the largest ag producers in the country last year. I don't know if we're still number 1 or if we dropped, but there's a lot of agriculture, dairy, so forth in here. So we do not look like the rest of California. Most people, when they think about California, they think like where you live, Southern California by the beaches or San Francisco, where we don't look anything like that. It is absolutely agriculture, horses, lots of cows, mostly cows, and so a lot of ag. Very fortunate to be here. And also Altura, again, it has 9 locations. We have mobile units. We have 3 mobile units. We provide lots of services. Our core services are pediatrics, internal medicine, family medicine, OBGYN, dentistry, and we also have a lot of specialists. What I mean by specialists is like nephrology, neurology, oncology, podiatry, ENT, what else? Optometry. So we also have behavioral health and many services. In addition to that, what you will notice is some FQHCs provide additional services, such as free transportation, outreach services, If you look at our social media, you will see the lot of outreach events that we do with our school partners, with our county, different partners that we have. We do a lot of stuff outside of the community, not just in the clinic. It's not just a doctor, MA, or medical or nurse visit. There's a lot more involved, a lot more. We also hire RNs and LVNs, not just medical assistants. Most private offices, you'll mostly just see a doctor and the medical assistant, but it's not here. Here it's definitely a huge group, a group of referrals. And I know you specialize in the call center and the front office. We call them PARs, patient access representatives. We have the referrals, the health information management. We participate in the 340B program for pharmacy. We contact with those pharmacies, Walgreens, CVS, and the other pharmacies. As for me, my personal journey.
It took you across the country, if I read right. You went all the way to the East Coast and back.
That's right. I actually come from a farm worker background. I'm from this small little town, so I came back home. Basically, I am very fortunate to have come back home. My parents are originally from Mexico. I was born and raised here in Tulare County, and here in Dinuba was the hospital when it used to exist. That hospital no longer exists. I was raised in Woodlake, always lived in Woodlake all my life. It's a small little town of over 7,000 in population. It's in the foothills. Beautiful, beautiful, small, calm town, and that's where I grew up. I started my healthcare journey as a candy striper, 8th grade. I was in 8th grade, and the local hospital here in Visalia, it's about 30 minutes. I'd have my dad drive me every Saturday, every weekend to go volunteer at Cahuilla Delta and volunteer my time there. I started in the library making photocopies. Back then, there was a thing. Now, that doesn't happen anymore, but we used to photocopy for the doctors to read publications. And then after that, the rest of the 4 years, I spent it volunteering in the emergency room. I would do translation. Back then, they didn't require certified translators. And the candy striper program was very successful, but then HIPAA came about, and then that program eventually went away. But it was a great opportunity for students. So I did the candy striper, volunteer, did that. And while I was during that time, you get exposed as a student to many careers. When you're growing up, you want to be a doctor, you want to be a nurse, but you never think about all those other careers and occupations that actually exist in the hospital world or healthcare world, right? You wouldn't think there's a PAR or call center or anything else, or somebody sticking a tube inside your throat, or anesthesiologist, or administrators. I never even thought about administration. But then I became a CNA, certified nursing assistant, and then a home health aide. And I knew that's not what I wanted to do long term. It's physically very difficult. I used to be very underweight, basically very thin, and I can't do this on my own. It's very difficult. There's a high need for taking care of the elderly. We call them residents. Very demanding, but I'm glad I had that hands-on patient experience because it adds value to what I do today. Now fast forward, graduate from high school. I thought I wanted to be a doctor. Went to USC my freshman year, to the big city of LA. You know how big it is. And being especially at USC, where there's way more students than there are in my little town, over 50,000 students or so, probably much more now than it was back in the late 90s. But I went there my freshman year. I stayed in the Latino floors, which was even eye-opening. Because here where I am, there's not very culturally that many diversity. But there I met people who were from Brazil, Nicaragua, El Salvador, Guatemala, all these countries that I've never met anybody, and the dialects are a little different, the words are here a little different, but we could just understand each other. The meal, the cuisine, the white rice, the black beans, totally different from what our diet was. But it's delicious. I love trying new things. And people from the East, Middle East, a lot of Asian cultures, especially at USC, is just beautiful. And getting to know everybody. So cultural awareness. And so for healthcare, that's when I'm my first semester. I'm in USC. I'm in chemistry. And I think I don't want to be a doctor. I don't want to do this. So I went to the School of Business, and they didn't have healthcare administration. They recommended a School of Policy Planning and Development, and they had it And that's where I ended up getting my bachelor's in public policy planning and development with a minor in healthcare administration. USC has programs out of state and internationally. I did a semester in Washington, D.C. through the Policy Institute. Now USC has a really nice building in D.C. And we stayed in the Virginian Suites at the time as students. I worked for the Alzheimer's Association there. Great experience, wonderful people. Very different. You would go inside the subway, everybody's with their newspapers. Now you go there and everybody's on their phone. It's night and day. Talk about transition of times, right?
Yeah.
And it was during the time of HIPAA, and the President Clinton was there at the time, and there were, in terms of healthcare, HIPAA was a big thing, the Privacy Act. And so anyway, I was very interested in the healthcare, did that. Then I did a semester in Birmingham, Alabama, and that was a great experience as well, very different from California.
I was going to say, to talk about, different places that you've been to.
Yeah, that was definitely very different meeting. It's just the weather, in terms of the weather, the environment. It was a good experience. Definitely recommend it for anybody who hasn't tried something outside. Everybody there was also very nice. I had a good experience there at the hospital at Eastern Health Systems. At the time, they were talking about merging, so I'm assuming that probably happened after I left. So did that, then came back, then graduated, and finished bachelor's, came back to the hospital. This time I worked in administration at Korea at the hospital. Then came back, did my graduate studies at USC again, did a master's in health administration, and did long-term care as well, because my passion is with the elderly. I really enjoy that area. Unfortunately, it doesn't really pay much, but that was a service. That's what I did. That's what my background was for healthcare. So lots of work, internship, shadowing. I always recommend to everybody, all the students, when I go talk to them in career days, is get as much experience as you possibly can, shadow. Because what happens when you go out into the real world and you try to apply? What do they ask you for? Experience. Exactly. And if you don't have an experience, do they hire you? No. I was one of those that I was lucky that after I got my master's, so I came back, went to the Tulare District Hospital, worked there, and finished. And there was a job opening as CEO for this clinic. It was a small little clinic at the time. This was 2003. It was by itself inside a village shopping center. And I applied. Now, first round, I didn't get a call. So they had a grand opening that morning at the Women's Center. They had just opened a Women's Center. So I came in person with my resume and asked for an interview. They had a recruiter who was doing it, but I think because they saw me so young, and what you said when you mentioned about experience, but I came in person, and guess what? I got a call the next day. That's great. I love that. The board interviewed me, and I got the job, and I've been here almost 22 years. So persistence and just being there, I think it really helps. That's an incredible story, and I don't know how many people are going. I mean, it sounds like you pretty much, one of your first jobs, was it the first job that you applied for, right? So you're probably the first person I've ever met who applied for their first job as CEO out of college, out of studies, and got the position. And like, what an incredible journey. So tell me, how does it, now, first of all, looking back now where you are, you have this incredible opportunity to really shape how lots of people in your sort of home community also, right, like are receiving healthcare, right? And do you ever find yourself kind of looking back and kind of reflecting on that, and if you do, what comes to mind? I think about it, but sometimes it's like there's no time. Healthcare, if you're in the healthcare business, there is never a dull moment. I can tell you every single day of my life has been different. There's no exact day where you just go in. And I'm one of those that likes to be out in the fields. I like to be in events that my staff is in. I like to go visit our staff. I like to know them by name. We have 286 employees. Now, we do contract out some services when outsourcing. We do outsource janitorial and maintenance. Everything else we employ here. We used to outsource accounting, but as the company grew, it's nice to have an accountant here in-house, but we still outsource some. We still work with some vendors. So it just evolved over time. But the Affordable Care Act, I think, is what really pushed a little more. And with Section 330 FQHCs, the nice thing about it is once in a while they will release what is called the New Access Point NAP grants. They haven't released them in years, but we did take advantage of those opportunities, and that helped the company grow. So we would apply for those. Now we ask for them all here, mostly in Tulare, except for one clinic we have in Woodville. And that adds additional revenue that helps us provide our mission. If you look at our provider roster, most of our providers are MDs or DOs. We do have APPs, the nurse practitioners, the physician assistants, but it's very nice that we do have a high number of MDs. And right now, the whole country, it is a provider shortage is affecting us all, especially here in the Central Valley because we are rural, and it's hard to recruit those doctors that like to live in the big cities where there's a lot of nightlife. But there are doctors who value the nature, so that's nice, right? And we have the small communities, small colleges, small, nice communities. But so how do you sell? The nice thing being about in the Central Valley is that you're close to the Bay Area, you're close to everywhere, you're in the middle. And so that's nice. How do you sell that? So recruiting the providers. But I have seen it change. The company went from that small little one clinic to what is now 3 mobile clinics. We have 2 mobile units that we use one for the high school and one for the Tulare City Schools. And then the other unit is currently going to the city schools. That one's for dental. We provide full dentistry in that unit. And so we are very fortunate. Mobile's on healthcare on wheels as well as permanent structures.
Just help me put that into perspective. When you started in 2002, so that would have been about 5 years after the formal independence and establishing itself as a FQHC roundabout. How many it was one location. How many providers, how many staff approximately at that time?
When I took over their full-time providers, full-time doctors, it was only 1 doctor and 1 physician assistant. But they had all of it was mostly contracted doctors. So there was no full-time. It was just them 2. But now we have close to maybe 60, and most of them are full-time providers.
Wow. And how many, and you said you had 298 staff members?
288 is staff members. And we do not hire janitorial maintenance, otherwise the numbers would be bigger.
Yeah.
And the accounting team, we still contract some of the accounting. In California, because you live in California, workers' comp is huge and expensive, right?
Yes.
So sometimes it's better to let somebody else handle that portion. And that area tends to have more workers' comp cases than anything else.
That's right. So, but just to finish this, so you're 288 today. When you started, when you took over, what was the total team size?
Of employees, in 2003, we probably had maybe around in the 40s or 50 number of employees.
Quite the journey. So, 22 years in seat. Talk to me a little bit about how did the operating model evolve, right? Like how do you go from managing?
Yeah, so one of those things, and I can see you're young too. You're much younger than me, of course, but when I was in junior high in Woodlake, a small little town, but we had computers already. We were using IBM computers. I took typing when I was in junior high. And I always was very competitive, especially with my friends, and I always wanted to be the fast typist. And so I was already, and in high school, I took the business classes, and I took all the software, and there we had, I think we still had the IPMs and the PCs. And so I mastered all of that, and I do love technology. So when you come to our clinics now, we actually have an IT department. We have our chief information officer who has his own staff. And one of the things that has evolved heavily, as you know, is electronic medical records, electronic dental records, the practice management software. Everything is technology, everything you touch. good and bad, right? But overall, I am very supportive of our IT team. And we do use AI, you mentioned, we do use artificial intelligence.
What do you use it for?
We use NextGen as our EMR. And
Mm-hmm.
so we're currently using Ambient Assist as our AI. Now, not all of our providers have embraced it yet, but those that have, some of them love it, some of them don't. But with time, it will get better. One of the things is that, for example, Spanish, it doesn't work as well as our English, right? So there's some limitations that is still being worked on in certain things. But it's a step. We do telemedicine, right? We do telephone visits. That's something that requires technology. We use a lot of automation in our practice management system. We do automatic posting. Most of our patients are on the Medi-Cal program, which is Medicaid. We do have Medicare, private insurance. We have about 17% private insured patients, but most of them are on the Medi-Cal program. So as much as we can do automation, which we do, that really helps. That causes efficiency and allows our existing staff to do something else. We also do texting, two-way texting. We've been doing it since 2017. We started with I think it's called, but now it's called Altura.
You started with it so early. It has a different name now. It's Artera
Yeah,
now.
Altura.
Yeah.
That's right. You know it. Yeah.
Yeah.
It's so our call center handles the texting and they handle the calls and a lot of it. And the nice thing with Artera is that we also have the texting, two-way texting, different lines. Our referrals department has it. Our medical records has it. Our nurses have it. So our patients are getting text directly by each department. It doesn't go in one queue and you'd have to figure out who gets it. It actually has a line with everybody. So that's the nice thing about Artera that they do have. And so all of this automation, especially with the new generation, it works out great. People don't like being on the phone or have to work and they could just text you. So all this technology has helped us evolve, become more efficiency. So the less people on the payroll, in a way, it's actually helpful because it allows us to do more in the community and for our staff. Because one of those challenges is that $25 minimum wage that we have coming up. Currently, California is at $21. And the timeline for community health centers or FQHCs is much more aggressive than hospitals. They get, I don't understand that.
Ironically, one might say.
Yeah, so a lot of evolution and a lot of changes.
So I was talking about this with someone else that was in a similar position. They started when it was one location, and they are now at like 50 locations even. So for instance, you mentioned you have a call center. Like, when did you set that up? When did you start to make the decision that, hey, we are now at a size where we need to sort of centralize something like calls?
The patient complaints is an indicator. So we all have patient surveys, right? And we have the complaints and so forth. When your patients cannot get through you, cannot connect with you, there's a problem. And when your employees are telling you, I just can't handle the volume, it's just too much for me, then at that point, you have to find a different, so that's how we did it. Like our medical assistants, I know many clinics use medical assistants differently. They share responsibilities doing referrals, front office. RMAs do not do any referrals. They don't do any front office. We have a dedicated department for referrals, a dedicated department for front office. For referrals, we use the vendor HealthView X. That's the one we use, and it's so far the best one we've seen. We've been using them for many years. I don't know if since 2018 or 2019. So that's worked the best for us. And because we provide so many specialty services, including OBGYN, we get a lot of referrals from outside the area.
Mm-hmm.
So this helps us so that they can submit their authorization through our website through HealthView.
And so how many locations were you when you started to centralize calls, for instance?
I think we were still at that one.
Oh, still at that one. So it was very early.
It was a very heavy volume clinic.
Yeah. And something like you centralized referrals, for instance, was that on the journey from 9 locations, 3 mobile sites, was
Now,
there?
referrals, we do have referrals in every single site except for the mobile units.
Got it.
So we
Got
do
it.
have medical records and referrals at each location because our doctors have that straight line communication with the staff members. They
Yeah.
like to go and tell them and communicate, and I think it helps when they're both in the same building. So they know they have an assigned referral clerk, they have an assigned HIM person, and they know who to go to.
That and that is also interesting. Is it kind of depends on what works best for your patients and your organization, right? And I think there's not every clinic, every specialty. Some are saying, look, we just need to centralize it because it's kind of all the same, right? Where sometimes there's more nuance, right? And this personal relationship of knowing, you can literally tap that person on the shoulder is actually more effective than having this centralized. So it's interesting to hear.
Right now, some of our doctors also tend to use their referrals or their HIM like an assistant. So sometimes they will help them say, oh, I need a letter for this referral for a specialty. So the doctor just proofs and signs, but he's not actually doing the letter. So sometimes they have them doing more than just that. So that's.
Oh. How about from your point of view? You went from overseeing an organization of 40 to 50 to nearly 300, right? What does it change about your role and how you manage and communicate to the larger organization? What changed and what stayed the same, right? You still know everyone by name, which is incredible. What changed?
Well, you hire very good, key, talented, smart people, and that helps when people who are very smart, very mission driven, very dedicated to what they do and go above and beyond. I have to say we have an excellent team. We didn't have a CIO when I started, right? I didn't have a chief project officer. I didn't have a chief nursing officer or chief human resource officer. And so it all evolved with time in hiring. There comes to a point where you have to realize you can't do everything. You're going to need help. And you're going to want to surround yourself by people who are even smarter than you, because that's only going to add value to your company, is surrounding yourself by these brilliant people, but also people who share your mission. And that's very critical. It's got to be somebody who aligns with your values, and the mission. That goes a long way. So that's one of those things that has been evolving over time, in addition to, of course, the technology.
How do you, when you talk about, mission alignment and an organization like yours that is so important, I guess everyone that works in healthcare, mission is really important, so let's put it this way. But how do you communicate? How does it change how you communicate from one location, 40 people, to now not everyone fits in the same room barely anymore?
Yeah, we used to have all staff meetings where we would all gather, we would all meet. Now we can't do that. So what happens, then you install monitors and TVs in every single break room, and that's how we dial in and communicate. We tried that for a while. So we now try to do more events. We do a lot of emails, we do newsletters, which we post on LinkedIn, my outreach team does. So but I know the LinkedIn version doesn't have all the stuff that we actually give to all of the employees, like the birthdays, the anniversaries, the new employees coming on board. We eliminate those pages from the newsletter that we post on LinkedIn. But we do communicate through that. I personally try to still go to all of our sites. And so communication is nothing like a one-on-one. If you look at our social media, we just had an event at the baseball. Visalia has a rawhide, and we had a baseball team, and we all went out there. We also had a movie night here at Tulare. At the outlets has a Galaxy Theater, and so we go out there and we try to mingle and do events with our employees, our families. We have the walk with the dog once a month with our community. We open it to anybody. It doesn't have to be our our patients, but we invite everyone. And so our employees, of course, are welcome to come as well. And I try to have an open door policy. Visibility is really key, and our HR department does a wonderful job trying to communicate. So letters, phone, events, company events. We use MedTrainer to train our staff because we have to provide documentation that our staff did attend the bloodborne pathogens or certain type of training. So that was the best thing we did was MedTrainer, if you're familiar with it. So
I want to go back on something you mentioned earlier, which is right, like and it goes back to, as the organization has grown, how do you think about what you want to do in-house versus what you outsource to partners? And I want to ask this on two levels, right? So how does that change over time? So you mentioned accounting used to be mostly run by someone else, but it's nice to have your own team in-house for certain things. So how does, and there are other factors like for janitorial that play into that. And I also want to ask, how does it play into your role really as an organization in the community, right? Because you are a very big part of the local community, and how does that factor into what into any of these decisions, if at all?
Right. Well, definitely finance drives a lot of decisions too, right? Efficiency, what is best.
Yes.
Also customer service. That's also very important. We want to make sure our patients are able to communicate with us and our providers as well. So, like I mentioned, the outsourcing with janitorial maintenance was due because of the workers' comp. Again, ultimately, it's the finance, but who can also do it better, and they're going to be happier. We knew we needed a human to answer the phones because the patients get frustrated when they talk to machines. So that's one of the things that people are people. They like that social, and they want to get a hold of people. It gets frustrating when you can't get a hold of a human. So that was very important. So I think you got to know your community. You got to know who you're working with, your audience. Who is your audience at the end of the day? And also, what can we pencil out and what can you afford, right? There's certain things you can afford to not have in-house, and there's things you can't. Now, many of our staff members are long-term employees. I'm not the only one that has been here 21, 22 years. There are some that have been here 19, 18, 20 years. They've stayed here for many years. So, yeah, some positions you could probably assign them somewhere else, but some of them, they do well. They've been here. They do a good job. And you just monitor. It's kind of like when we went for the call center, we knew at that point they couldn't handle anything anymore. So we created this call center. That's the only function that they focus, and they do it well. And they do more than that. If there's ever any downtime, they do other activities. They do other things, other jobs, other tasks, and helps us get caught up on whatever we're missing. So it's also got to be a vendor you trust. So when I look for a vendor, we recently were looking for a new janitorial place. And so it's got to be somebody you trust. They're going into your healthcare facility, and they're going to be encountering private information. They're going to be here all day. They're going to be handling private information. So it's definitely going to be somebody who's going to be accountable, who's going to listen to you, and is going to address any issues, and be also very professional with anybody that comes through our doors. They become like employees. Once you contract with a vendor, they are an extension of you. They represent you. Even if they're wearing another hat, they're always wearing this hat. And you know how California is. It doesn't matter if they're employed by you or not. As soon as they're in your premises, you are liable for that person. It doesn't matter if you're not the direct employer.
I think it's interesting, and something that I so agree with is whenever you let other vendors become a part of your organization, ultimately, in every single conversation in the world, the word trust comes in, because it's different than picking a technology tool, right? Like, it is truly about, like, are there shared values? Is that person learning and adapting, that organization learning and adapting to you? So I'm curious, if you can expand on that a little bit, right? So you've worked with a number of vendors over a good amount of time. What what makes vendors and providers really in that model stand out for you?
Yeah, so for example, let me see, I'm thinking of a long-term vendor. Okay, I'm thinking like, for example, like our maintenance person who we've been working for. Actually, he's been working with us under different since I've been here. So somebody who's familiar, and I trust him to go into our. He's dependable. He's reliable. He gets the job done. Um, communication. Communication. Always been somebody who's dependable. He's always been an honest person, and I think that matters. You know, sometimes we also get other people. If you have a good relationship with a vendor, I mean, if you have a difference between, say, $100 or $200, it's not worth changing. But it's really got to be, you also have some sort of loyalty. You always talk to that person first before you even make a change. But I usually stay with those that I trust.
That is, I think it really goes to, it's so interesting because I've had so many discussions over the past few months that I used to think when I was much younger and I was selling consulting services, it was about the right pitch and the right angle, and that I think there's always an element for any new person that you meet about, is the person credible? But I think specifically the more operational the services skew, it just becomes about trust, right? And and I think that's a big part of also how folks hear about vendors. I'm sure you're much more likely to engage a vendor that was recommended by someone that you trust, right? Because it's that extension even of trust. And I feel like it's not even talked about as much maybe as it deserves, because at the end of the day, a lot of what is out in this world is about, like, can you convince someone that you can trust them, right? So yes,
someone who's genuine, who seems like they're honest. Now, some of these vendors that we have met over the years, I'm not gonna lie, some of them is because we've met at the California Primary Care Association. CPCA is the primary care association for us federally qualified health centers in the state of California, and we have our annual conferences and different types of conferences, and we'll have vendors sponsor, and they'll have booths out there, and so it's like their first pitch and introduction to us. And the fact that they have been working with multiple FQHCs, not just us, I think it helps as well, because that tells me, okay, they're familiar with our world, because our world is very different from most facilities. I mean, we don't bill like hospitals. We don't function like hospitals. Now, we have to meet standards like hospitals, but we don't operate the same way. And, a boss, one of my former mentors, he mentioned to me, well, we're not any different from you. He was a hospital administrator. And I said, no, there is a big difference between you and the way our mission is. It's not the same.
Yeah.
It's definitely not the same. We want the Medicaid, we want the uninsured patients, and you probably don't want those. So I'm thinking it's like, our missions are different. It's in the borough primary healthcare. Why are we here? We're trying to, now we do see private insured patients. We see everybody and everyone through our doors. We provide the best quality we can to our community, regardless of payer. But our goal is to improve, decrease the disparities of health. We want to, our goal is to make sure that everybody has access to good quality care. I mean, and I think having 17% private insured patients as our patients speaks volumes of that, because they do have options. They could go elsewhere, and they choose to come here. So that speaks volumes.
It does. Maybe on that note, so I'm sure you've seen lots, or you've overcome lots over time, but can you share one of your greatest successes in really establishing the organization that you are today, and really maybe more tangibly solving a healthcare operations problem? And for what it's worth, reading about even your organizational mission, also to think differently about finding providers even from Mexico to come practice, I think is is really cool, and I haven't seen many organizations do that, but I'm curious if there are others that would be of interest to this audience.
That is indeed one of the successes. We didn't think that program that you're talking about, the AB 1045, which is where we brought doctors from Mexico who are alumni of UNAM, one of the largest universities in the western hemisphere of the United, here of the America, actually, this continent. So that was a success. We're very proud of it. We currently have 6 doctors that were issued California medical licenses. Now they are to return back in 3 years. And this was pioneered by Dr. Cuevas, and he and his consultant Arnoldo Torres worked on this project. When they invited me to join, it was only 4 of us FQHCs. This was around 2016. We invested it and we gave it a try because we are desperate for doctors. We don't have very many, and I mentioned to you, having the MD and DO adds quality to the care. And I do believe also that APs, nurse practitioners, and PAs also provide a great service, but I do feel that they need the support of the MD and DO. There's got to be a good ratio. The more support they have to these MDs, I think it strengthens them as well in providing better outcomes. So that was indeed one of the successes. By the way, that was a pilot. Now fast forward, California has approved the legislation to extend the program permanently for 15 more years, and now it's been extended to 30 more FQHCs that can start this next round, which is great because now they'll be able to also hire some of these doctors. But the caveat is that they must return in 3 years, and then after that, they no longer have the California medical license. They're excellent, by the way. Some of our doctors are pediatrician, pulmonologists. They have specialists, and with our specialty shortage here, it comes as well. It's just amazing because of the shortage of specialists. Patients have to wait a long time to see the pulmonologist or so forth. Here they can see and bill as a pediatrician visit, but they're seeing an actual pulmonologist and can start addressing and start treatment right there and then without having to wait. So that is definitely one of the pluses. I would say one of our most successful, I've always wanted us to own our buildings. When I interviewed as a child, basically I was very young when I interviewed with the first board, and I told them, I want us to own our properties, have our own building. Slowly, we own almost all of our clinics except for 2 now. But the big one is the one we just recently opened. It's on Cartmill. It's a huge, there's a pediatrics in the corner, has its own building. OBGYN has its own building, and then administration is now all together. We used to be fragmented everywhere. We're all together. This is phase 1. This is all being built on a 10-acre lot. We now have a place to house our mobile units. We had been housing them at the school sites. We're very fortunate that we have supported school systems, the high school and the city schools. We had been having them, but they also are growing and they need the school barn because they need more buses. So I'm sure they're happy that we're gone now, but we are very happy for them letting us park there all these years. But now we have a station for them. So that's also one of our successes. Now, I couldn't have done this all alone. It really is a team effort. You can't do something all alone or take credit for something all alone. It's really a team effort. And again, it's that shared mission of everybody of the team who made this happen and possible. Now the patients love it. They're enjoying it. There's more parking, larger waiting rooms. Those are the common complaints they used to give me. So I think those are some of the most the successes. Of course, in the technology keeps on getting better. Patients like to do more on their own, having access to information, the patient portals. There's really a lot, but I would have to say that those are some of the key successes.
That's incredible. That is what a journey from one clinic I think you said it was in a shopping mall when you first started.
Yeah, and then the main one is still there. Someday I want to bring them over here. But I'll leave you with this. I do want to share this with you. I always tell the team, because I know many, do I really just want to open all our clinics? And I feel that strengthening our company, adding more services, adding a more quality, spending that, if we can make a difference in people's lives to live longer, be happier, have more excellent feedback, positive outcomes, And so I try to invest more and more and more in how to enrich each person's life. So my goal is to make the company stronger, provide more services. Yes, but we're mostly all into Larry, which is nice because most doctors don't like to be moving from place to place. They like to be in one location, and I think that's really been helpful. But it's what do you want to people to remember you by? So we're not going to be here forever, and definitely I'm closer to the end than I am to the beginning now. So it's like, what do you want people to remember you? And I definitely want to hear more good things than I do bad things. We can just do the best we can, but did we really? So that's definitely what our mission is.
That's powerful. I have two final questions for you, and we can make these quick if I may. Specifically from your perspective and in the FQHC world, what's one thing everyone should pay attention to in the next year?
They need to be paying to it now. Now, I also serve on the board for the California Primary Care Association, and I can tell you one of the reasons why I'm in there is because of advocacy. Also because I'm in the Central Valley, I feel like we should have a voice. Sometimes what we want or our needs are very different from the northern and southern side. We do have the largest amount here in Tulare County. We have the largest amount of people enrolled in the Medicaid system. So what should we be looking for at the state and federal level? It's all of these legislations that are impacting us. Medicaid cuts. So that's why I was telling you, we have the largest amount of Tulare people enrolled in Medi-Cal in the state of California. Yet we may be facing Medi-Cal cuts. So we can't do everything we do and serve our mission and pay our employees up to $25 minimum wage. We're currently at $21. In 2026, we have to be at $23 an hour. Now, when this happens, we don't just pay everybody the same salary. We bump everybody up at domino effect. And if you think about it, I've been telling you some of our employees, RNs or LVNs and so forth, have been with us for over 20 years, 19 years. So their salary is probably like in their 30s or something an hour, right? So you now bring them up because they can't be earning the same as somebody who's just coming in. It's just not right. It's not fair, right? So then that brings up the expenses. So that's going to have definitely it's going to affect all of the clinics. So being on top of the Medi-Cal, the Medicare, because I hear even that they say might get affected, and everything that is going to affect the bottom line.
Yeah, it's very much something that, especially in my FQHC conversations, comes up, and it's active work in progress, but that I think will have a big impact. So it'll be interesting to see how that plays out.
And every day seems like there's a change. Now we're gonna hit here, and then hit here. So it's just being on top of it and constant communication with your legislators. Even when they don't want to return your calls or see you, you have to at least always be sending your emails, your calls, or letters and phone calls. You just have to be able to voice your opinion, and hopefully they'll listen. All you can do is try, but it's definitely a lot of lobbying and a lot of lobbying that has to be going on right now.
Well, look, I know we are also up on time, but I think this is a very important and maybe a good way to close our time today. I think it's a good reminder to everyone. Make sure to partake in the process and speak your voice. There's a lot of things in the move happening in the legislative world that will have an impact on healthcare for lots of different people, and so we all need to partake. Well, hey, this was an incredible, I always learn something going into these types of conversations, and I appreciate you sharing about what you have built and your journey. It's certainly really inspiring, and again, it's incredible to just have learned, even in this short amount of time, a little bit more about your path and how the organization that you've helped shape. So thank you very much for all this time and sharing your thoughts.
It is my pleasure, Frederik, and wishing you the best of luck. Thank you.
Thank you.